I am Dr. Sridhar. Please do subscribe to my channel and share this video with others who might benefit. One of the common questions we get is how do we approach a cold in a baby, an infant? Most of the colds are caused by viral infections. When the family members get a virus, it spreads to the babies as well. And even though the maternal antibodies are in the baby's system, it's not often effective to a cold virus. As we know, we ourselves get the cold repeatedly, even though we have been exposed before. The immunity is not long term. When a baby gets it, we are worried more because fever or symptoms that occur in a young infant, especially in the first 3 months, are quite worrying. Any infection can spread into the bloodstream and become a serious infection or even meningitis. So we do suggest that if an infant under 3 months of age has fever, you should always review with your pediatrician who might suggest blood tests. But apart from that, once we have ruled out serious infection and we know it's a viral infection, symptomatic treatment is all that we need for viruses. So if multiple members of the family are affected at the same time, it spreads quickly between individuals, and so a virus is more likely. If you have a runny nose, sneezing, in addition to a low-grade fever, it's most likely a viral cold. However, if the age group is young, better to get your baby checked. When we say symptomatic treatment for a cold, the most important focus is on breathing and reducing symptoms like cough. If the baby has fast breathing or difficulty in feeding, it's again an indication to review with your doctor so that they can advise you on the appropriate management. Some of them may improve with just improving the nose block, like nasal spray for salt water and so on. But if the baby continues to be feeding poorly, we may admit, monitor the baby's oxygen levels and support by tube feeding and so on as well. Viral infections do not need antibiotic treatment, so there is no specific treatment needed on that front. The clearing of the nasal secretions is a difficult issue. In small babies, the nose is small and often tends to block off. The nose extends from here to the back of the face, and it's quite a long area. The nasal passage is narrow in babies already, and when there is the swelling of the mucus lining, which happens with the cold, they get quite blocked. So the most important thing is to keep the room comfortable, not too dry and not too hot or cold. The nasal sprays, the saltwater sprays, do physically help by clearing the nose, by taking the secretions back. We don't need to suck it out every time unless there is secretions overflowing. We don't need to use a suction to remove. Suction is often irritating for the baby, and you only suction out the most superficial part. You can't go inside the nose unless you're in a hospital and they do deep suction, which again is not recommended. So sucking out is not essential. Just use the spray repeatedly for the secretions to be taken back into the throat. And using the salt water repeatedly is acceptable, but don't use forceful sprays because it can affect the septum. When you spray it, it can cause erosion and it can be irritating to the baby as well. Positioning is important because lying flat blocks the nose more. Give a little bit elevated position like 30 degrees as we suggest for refluxing babies may help in the colds as well. The cough often happens because the baby is mouth breathing with the nose block, and they get frustrated, the newborn babies, and in the first month or so they get fussy because they can't really efficiently mouth breathe at this age. So it becomes important that we clear the nose and position them so they're able to breathe comfortably. When they mouth breathe, the dry air goes back and irritates the back of the throat, so that causes a cough. And during the cold episode, we try to keep the feeds small and more frequent because a bigger feed tends to reflux when the baby coughs or strains, and this aggravates the coughing as well. So a smaller, more frequent feed is okay, and viral infections often cause a low appetite in the baby, so remember that the baby may not be as keen to feed as usual. Humidity in the environment, I mean, it's not always in your control, but if you have a humidifier within the room, you can use it. It's not essential. If the air is dry especially, it's okay to use it. Antihistamines or anti-allergic medications do not have any role because they only dry the secretions. If you have allergic rhinitis and you have repeated sneezing and runny nose, it's okay, but a young infant usually doesn't have these. In the first day or so of a coryzal symptoms, when we call the runny nose, sneezing, for that day alone, it might help to use an antihistamine after 6 months of age, but not before that. Cough suppressants are not to be used because cough is a protective reflex, and suppressing the cough is going to be sometimes harmful for the baby. The infection stays in, and cough suppressants often are sedative as well, and any sedative medicine in the first 6 months is dangerous for the baby. So don't use any combination medicines, and don't use antihistamines unnecessarily in the younger infants. That decongestant medications, the local instillation or sprays of xylometazoline 0.05% or so, can be considered in the older infants at night, especially so they get to sleep. But in younger infants, it's not recommended because there is a risk of triggering heart rhythm disturbances. The same issue applies to syrups like Actifed, which have pseudoephedrine or phenylephrine in them, and these are dangerous for the infants. They cause tachycardia, they have fast heartbeat, they may cause rhythm disturbances, and it is dangerous. So please don't use medicines which don't help and at the same time may be harmful as well. So the symptoms generally take a 3 to 5 day period to recover, but a chesty cough often follows this viral infection in infants. May start by 2 to 3 days. It sounds chesty, it's because of the narrowing of the airways and the reactive airway narrowing called viral wheeze, and it can persist for 2 to 3 weeks. If the child is active but the cough alone is significant, you can continue to monitor. Nebulized medications may help in some children, but they're not essential because this is self-resolving. Again, the cough persisting by itself is not a reason to use antibiotics. So most of these are post-viral episodes, and this can happen every time the child gets a virus. So you have a viral infection happening, then the repeated infection might come up from other members of the family, and the cough continues for 2 3 weeks. By the time the child recovers, they go back to school, or the siblings go back to school, and a fresh virus may affect them as well. So in summary, I mean, symptomatic treatment focuses mainly on clearing the nose, avoid the use of unnecessary medications, and by keeping the room temperature controlled. During the night, keeping the nose open does help by reducing the cough induced by cold air hitting the throat. Monitoring the feeding, monitoring the hydration, and symptomatic treatment of the fever in the acute phase are all essential aspects. If the child is not feeding, not active, fever persists, or you have other concerns, baby may need antibiotics after reviewing. So go to your pediatrician for a checkup. I hope this helps. Do share.